30 years ago, we were still saying, okay, you're gonna live with diabetes. We don't know how long you will have complications. Now we have done major clinical trials that have shown that if we reach certain targets for your diabetes, we actually can stave off complications, eye disease, kidney disease, heart attacks, everything like that by more than 50%. For type 2, there are new medications coming out every few years, new classes, entire classes of medications.
New generations of drugs are being developed, particularly for type 2 diabetes, that are drugs that not only help control the sugar, but in some cases also help control body weight. And then the second thing I think is that for type 1 diabetes, which is really an autoimmune disease, the endocrinologists and diabetes specialists and diabetes researchers have begun to work closely with the immunology community, the immunologic researchers, to tackle this disease, to block the immune response. So if we can take advantage of that knowledge and find the right immune therapy for these patients, we could potentially even prevent the development of type 1 diabetes in people who have this pre-diabetic process going on.
The fact that we're in the era now of therapeutics to possibly cure or delay the onset, that's really exciting. I think the artificial pancreas is a huge development, and it's supposed to work like someone's native pancreas. And I think that will revolutionize how patients with diabetes feel and how we as doctors really care for patients. And then we have insulin pump, we have continuous glucose monitors, we have all this technology kind of rushing into. So right now is a very exciting time to be a diabetes practitioner, but also to be a diabetes patient, because you have a lot more options, and I think the future looks really bright.
I think one of the things that the Endocrine Society has really done over the last few years is try to bring more attention to endocrinology as a specialty and bring this vision that endocrinologists are being very active over setting guidelines for therapy, guidelines for attempts to prevent the development of diabetes in people at high risk for diabetes, about nutritional guidelines as well as pharmacological guidelines. This is a huge interest of the endocrine community, and it's an interest where they've had tremendous impact, and that's really gratifying to me.
What's exciting about endocrine is that people are suffering for so many years, and everyone wants to help, but they can't find the answer. And if you, as the endocrinologist, find that one thing that really can kind of turn everything on its head, it's a beautiful thing. It's like why we went into medicine.